Hi, I'm Deborah Truhowsky with the law firm of Schwartzapfel Truhowsky Marcus. Welcome to this edition of New York Safety Net's program, Spotlight on Aging and the Elderly. Hi, I'm Deborah Truhowsky with Schwartzapfel Partners, and I'm sitting with Katherine O'Brien. Katherine is an attorney in our nursing home department. And in addition, Kathy also is a nurse, and Kathy has also worked for a number of years in-house at a risk management company that handled nursing home cases and medical malpractice cases. Kathy and I were just discussing a case in our office where a woman found out that her mother has pressure ulcers and didn't necessarily know what things to ask about and what things to question to make sure that her mother healed as well as possible from that pressure ulcer. So what I'd like to do is to open up the conversation and to speak a little bit with Kathy about some things that she would suggest that a family look out for. Kathy, so if you would just tell us some things that you think would be important for a family to look out for.
Well, first off, I'd like to say that many times I found family members tend to be intimidated or a little afraid to ask questions, and I think that as an advocate for your loved one, you shouldn't be intimidated, and you should be forthcoming with any questions. If you have any question in your mind that your parent or loved one has some sore that you're concerned about, and you haven't been straightforward, and the caregivers haven't been straightforward in discussing and telling you, I think you should not be afraid to ask, and try to observe your parents' skin. I think that being observant and asking questions is the first response that I would have.
And if I could ask you a question, in terms of like who a person would ask questions of, would they start out with the nurse or the aide, or who would you recommend that they speak to?
Generally, the first person that you would probably come in contact with that would have any knowledge regarding skincare would be the nurse. I think nurses' aides certainly are involved in cleaning and changing the bed sheets and linens. However, I think the person that would be most knowledgeable would be the nurse that's in charge of your parent or loved one. Okay. And then the next step would be certainly if there is a doctor that is in charge of your parent or loved one's care, certainly that would be extremely helpful to discuss the steps that they're making, if indeed there is an ulcer, to get that ulcer healed as quickly as possible.
And when they're visiting, things like we hear a lot about turning and positioning.
Right.
How important is that in terms of pressure ulcer prevention and pressure ulcer healing?
Right. Well, certainly if the patient does have has decubiti ulcer, then they should be turned every 2 hours. And if your parent or loved one is immobile, meaning it's difficult for them to turn themselves, or they have some limitations, that they should be turned every 2 hours, and turned from one side of the bed to the other side of the bed, being propped up with wedges or pillows. If they have difficulty with movement in their lower extremities, they should always have pillows in between their legs to prevent any rubbing of the joints, the knees and the feet. They should also look for any type of devices where they could relieve pressure. For example, in the heels, many times patients, if they lay in the bed and they're in one position, their heels are rubbing and they cause a lot of pressure. They should have heel pads or pillows to prop up their heels, and things along that nature. And I think that it's important that you should always observe for these things, and if you see that they're not being done, then certainly I think it's important to ask questions and determine why it is that they're not being done, and encourage the nurses to discuss it with the doctor so they can order for these particular items.
Okay, great. Kathy, thank you so much. I really appreciate that, and I think it was very valuable for people to know. And we'll try to continue to have different segments such as this up on our website so that it will help people in going through what can be a very difficult time when their loved one is in a nursing home. Thank you.